I like you.
Thank you. Good afternoon, everyone. Thank you for attending. This Scrutiny Committee meeting is being conducted on a hybrid basis in accordance with the Local Government and Elections Wales Act 2021, which will operate alongside the Council's standing orders. Council standing orders and code of conduct can apply at all times, and members should conduct themselves accordingly. A recorded version of this meeting will be uploaded for public viewing as soon as possible after the meeting. Welsh translation of the proceedings can be provided upon request. The images and sound recording may also be used for training purposes within the council. If you could all leave your cameras on so we can be part of the meeting, that would be great. Thanks very much. Okay. Declarations of interest, please.
I've got apologies here from Councillor Harvey, Councillor Jenkins and Councillor Reynolds, and from our cabinet members, Councillor Lucy Dees, views from my family. I do not say this.
Great, thank you. Are we going to the reviews and go back to the minutes?
Entirely up to you, Joe.
Okay. Jump into the service area reviews first. And yeah, would you introduce the volunteers?
Yeah, absolutely. Thank you, Claire. So the report in front of you today is the end of year report for adult services for 24-25. And you can see within the content of the report, there's an executive summary by the head of service, followed by an overview of the service area itself. And then there's an update in relation to the objectives that have been set during that year and an action plan update. And there's also an update in relation to the programmes and projects that have been delivered during that year. And then finally, towards the end of the report, there's some information about performance measures and case studies. So really telling the story of what difference it's made to citizens of Newport. And then the supporting information within the report centres around the complaints and compliments that the service area has received, workforce development information, and then some finance information and workforce information at the end of the report. Yeah, I don't plan on going into any more detail than that because I'm sure that members will have read the report and very happy to take questions.
That's great, thank you. Thank you, Tony. I think on the overarching, we did find a very positive report. It's good to see, but yeah, we're going to do a bit of a delve down into a few more issues. So, out to the floor, we'd like to start.
Bear with me, Chair, for my question. I will come back in a second. I'm just having a bit of a computer mare. 2 secs.
Don't worry. I'll start with Trevor and Steve.
Centric logic, very clear. Are these day centres or residential centres? And how many people are we talking?
Okay, so I'm going to hand immediately over to Lucy, who actually frequents these establishments.
Yeah. So these are two really positive pieces of what we're doing, and this is the story of what we're doing. So T Clare was opened last year. It was named after Claire Davis, who was a long-standing member of our team who worked tirelessly to promote the and advocate on behalf of adults with learning disabilities. T Clare is a home for an independent living provision for adults with disabilities, which is a high quality living environment for those individuals. We do not run that ourselves. It is there supported by POVL, who use grants to refurbish the property. Prior to those individuals moving into T Clare, they were likely to have been living in with their parents, who would likely to have been quite old themselves, or in other accommodation which wasn't meeting their needs any further. Centrica Lodge is a property owned by and has been owned by the council for over 20 years. It was gifted to the council and until December 2023, it was managed on our behalf by external organisations. In December 2023, the provision was brought in-house. It provides short breaks for adults with disabilities. These adults are people that live with their parents. Very often, again, their parents are older people themselves or might be middle-aged. So these people need a break from the day-to-day work of caring. So what's been really fabulous about Centricus as we've taken it back in-house is that we've been able to improve the service. We've been able to improve the fabric of the building, and we've done a lot of engagement with the parents and service users that come to stay with us around the care and support they would like. And I'm very proud of this. The feedback we've had has been that the service has really improved since we've taken it back in-house. So that's not about me, that's about the team. And the team came across from the previous provider, so we took them across to us. And the feedback we've had from them is also that they're really pleased to be employed by Newcastle City Council. So, you know, we're considered as an employer that is supportive of them. The training we're providing for them is of a greater quality than they received previously. You know, we are a fair employer and they really appreciate that.
So how many users actually use that?
We currently have 59 families supported. There are 6 people could stay with us at any given time, but 59 families are supported. Now that's an increase from 50 when we started back in December 2023. But we've also had people move on into supported living, such as T. Claire. So we've actually had a really good throughput of individuals. And part of what we do at Centrica is if somebody is on an independence plan and they're looking to move into supported living, so they're looking to be living independently from their family, we support that and we help to develop people's skills. So whilst they're with us, they will make a meal for themselves with our support. They will do laundry if that's appropriate. We will support them to do shopping, to do travel training. We do everything we can to move them to the next phase of their lives. So it's been a really positive thing to take Centrica back in-house.
Right. Say T. Claire is managed by Paul.
Yes.
Do we actually own the building now?
I believe not, no. But as part of our independent living strategy, we're identifying and working with, identifying properties and working with third sector in order to develop property that's suitable and of a good quality for adults with learning disabilities.
Anne, can I bring you in?
Yep, thank you, Chair. Afternoon all. Sorry, I'm at home. Yes, it's really positive about the homes. Excellent work, well done to the teams. The question I wanted is on page 13 on the direct payments. I just wanted a bit of an update really on especially people with learning disabilities. Are they managing to pay their direct payments? And because I know it is in amber, but it says the completion date is the 31st of March 25. Why is it in amber? Any particular reason?
Thank you, Councillor Clevy. That's a really valid point. And when I was re-looking at the report prior to this meeting, I noticed exactly that issue and would have asked the head of service, had she been here, the reason why it was amber, because the narrative against that action for me wouldn't indicate that it should be a green, because it sounds quite positive. So unless Lucy can add to that, I think that would, if you could leave that with me and we can reply to that question following the meeting.
Yeah, that would be great. If you look at it,
Yeah, thank you.
Payment service users.
Yes, so
Yeah.
we can certainly take that.
It does say an excellent audit reports, how it reflects on the developments of the process. So, you know, I just couldn't see why it was in amber. just thought I'd ask that question. And Chair, can I ask the other question I've got about the HR safeguarding?
Sure.
And apparently that is in amber. Hang on, I'm looking for it on my tablet now. Yes, just on page 15, and that was completed in March 25. And it says the action is to ensure mandatory safeguarding training is delivered to all new and existing staff in the council. And it said that the human resources, yes, they've created better reporting data collection. So why is that in amber? You know,
Chair, I'm really appreciative of you actually paying attention to that level of detail in the report, because exactly that point in my mind was something that I picked up prior to coming into today's meeting. What I can tell you from a operational point of view is the council has now developed a corporate safeguarding board, whereby all of the reporting of training of staff and the uptake of the safeguarding training is reported into that board, and the systems and mechanisms in place for capturing that now are much more robust than they were this time last year. So being the chair of that corporate safeguarding board, I can categorically assure you that that is in hand, and it is there are improvements and measures in place for very tight monitoring of the uptake of that safeguarding training. So all of those measures are in place. There are improvements to make for the numbers of staff who have completed the basic safeguarding training. And I think, you know, we just need to put a little bit more context around that, is that within social services, our staff are trained to a much higher level than just the basic safeguarding training. And we are, there's a national training programme that is in the process, as I speak, of being rolled out in different levels and stages of safeguarding training, depending on your role in the organisation. As you would expect, social services staff will have a much higher level. So this is really just talking about that basic training. But I agree with you as well that I wouldn't have put that down as an amber. I would have said that it would have been a green, because the systems and processes are in place. I suspect, had Navanwi been here, she might have said I put it as an amber because there is still improvement that needs to be made around all staff just doing that basic level of training and evidencing that, even though they have already had a higher level of safeguarding training. We've had huge debates about that in our own departmental managers meetings about is that necessary. However, there is a corporate view, and I would support this, that we need to evidence that all staff, regardless of where they work in the council, have we can evidence they've all had that basic level of training. I hope that answers your question.
Yes, thank you very much for that. As I know, I used to work for the youth service myself, now retired, and safeguarding is a very, you know, good topic, and is very, you know, high on the list for the training on all workers. I even had to write a safeguarding policy for my community garden, so I know how valued the safeguarding policy is. But thank you ever so much for that. It's really good to hear all that. Thank you.
If I can just come in on that then, Jan and Tanya, if you don't mind. So with regards then to the amount of people that need to undertake this training, will there be any sort of metrics then coming into the sort of midterm report for 25-26 that we can then sort of analyse a little bit further?
So what the plan is, so I think it was last week, in fact, the annual safeguarding report went through to council, and there will be another annual report that will come this time next year. And that information, not just about social services uptake of the safeguarding training, but every directorate across the council will be contained in that annual safeguarding report. So it will come through that mechanism.
Steve, are you back online with us now?
Yeah, I've still got a thing in the background, but I've just been sending myself some stuff, so I should be able to cross over if needs be. Seeing as we're talking about the safeguarding aspects of it, the question I'll bring in as well is in light of the rising safeguarding referrals. Is the restructure listed in the report sufficient enough to ensure robust first contact and triaging?
I think Lucy may want to come in if she wants to on this, but first of all, I think it's important to raise that safeguard. We've had a recent CIW inspection, and they highlighted the fact that we had robust safeguarding measures in place. So I think we could take some assurance from our regulators' view of the service in that respect. The demand continues to increase. And I know that Myfanwy and her service managers are undertaking a review of the service to try to make sure that we can continue to meet that demand. But if the demand continues to increase, then there is a conversation to be had at a corporate level about the capacity that we currently have and the possibility of increasing that capacity to meet the demand that continues to come through the door, because it isn't just in relation to, safeguarding referrals. In adult services, it's an increase in demand for services generally. So that is definitely something that is being looked at as part of the reviews that are ongoing at the moment in adult services.
I don't really have a lot to add to that, apart from it's something that we are monitoring closely, and we're conscious of the rising demand. And that's not just about Newport, that's about the whole of Wales and the whole of the UK. There's demand for adult services, and part of that is greater awareness of people that are at risk and need safeguarding support. So it is something we're very conscious of.
I think that's very evident if you look at page 19 report with the performance measures, with sort of the quite significant rise in some of the figures that you're actually dealing with, which is, again, as we mentioned earlier, it's great that you're covering it. But my question on that would be, say, number of adults, reports of adults suspected of being at risk with necessary inquiry to be made, when that's jumped by 200 people. Fantastic you're covering it, but what sort of pressure does that bring upon your resources and your team? And have you got the measures in place then to be able to deal with that sort of rise going forward?
And I think the review that's currently being undertaken by the head of service and the service managers will get to that end point and that view about to continue to meet that rise in demand.
Yeah, on that same thing, was there any reason for that big jump in dealing with those? Were you fully staffed at the beginning of quarter one?
So are you asking, do we understand the reason for the increase in the safeguarding referrals? So it's nothing to do with our staffing capacity. So because if you're maybe suggesting that we dealt with them, or we didn't deal with some because we didn't have the right staffing, and now we're dealing with them because we are required under legislation to deal with safeguarding referrals within a particular time scale. So there's no choice in that. We can't just wait and say we'll deal with them next month. They have to be dealt with within set time scales. So the reasons why they have increased, I think there are so many reasons. why that could be the case. It's very difficult to pinpoint. Obviously, Lucy may have a different view. We do a lot of awareness raising around safeguarding and the need to make safeguarding referrals. So it's very difficult to say that it's down to one particular factor. Lucy, I don't know if there's anything you want to add to that.
One of the things that we have seen an increase in is financial abuse. And I think there's much more awareness of that amongst the general population. And also because of the cost of living, it is perhaps people taking advantage of that situation. So that's as much as...
Sorry, can I just get across and clarify, what do you mean by financial abuse?
So I'll give you a case study, might be a way of explaining. So at Parklands, we had a gentleman that came to live with us, and he was subject to, he'd been referred to safeguarding. He'd been referred to safeguarding because his son had been basically using his money to fund his own lifestyle. And he'd done that because he'd taken control of his father's bank account. That's the high level, and there's some unpleasant bits in between. But sadly, we've seen a number of those types of cases rise.
Following on from that, in regards to the CIW report, it says the final report highlighted some strengths within the workforce, but it doesn't mention any about weaknesses. Did they highlight any weaknesses? Not it informs of weaknesses.
No, thank you for that. And I think it's fair to say they didn't highlight any significant areas for improvement. They did. There was something in relation to the workforce that they mentioned, which is about greater training about the approach that the workforce takes to a strengths-based practice, it's called. So basically, in layman's terms, what that means is when you go and you assess a person, that instead of looking for the deficits immediately and you go in on a negative footing, that you go in and you look at the strengths that that person has, and the conversation is very much around what is important to that person, what do they want to see, what's important to them, what do they want to continue to do, and in their own homes, whether that's stay at home or continue a daily activity. So the feedback was that could be improved, the strengths based approach to practice. So
how do you plan to do that?
So we have a plan in place. So one of the things that you'll see a change in next year's report is that there may well be a workforce plan attached to these annual reports. We're just thinking that through now as a corporate team, but certainly as a social services department, we have developed a workforce plan which talks about how we recruit staff, how we retain staff, make sure our staff are appropriately trained, and look after our staff well-being. Within that middle bit about retaining staff, there will be an action in that plan about rolling out en bloc a programme of training around strengths-based practice. And there are providers, very good provider out there. We have had training in strengths-based practice previously in reports. So please don't think that that isn't in existence. No. I do think, but it was identified as something that we could strengthen.
And the other area that was highlighted in a low-key way was the need to develop more what we call AMPs, so mental health professionals. So this is a qualification that social workers have in addition to their professional qualification, which allows them to support people with mental health issues who are in crisis. and we actually, compared to other parts of Gwent, we're quite well provided with the numbers of people that we have. Sorry for the helicopter, but we still need more. It's a tricky job. It's a hard job. It's a job where you have to be dedicated to undertake it. It does come with an allowance. However, it's not just about the money. It is a tricky job.
That is how we can improve the service which we provide.
Yeah.
That's what we're trying to get at.
Yeah.
I could just pick up on that in terms of the workforce, obviously, development. On page 22 of the overall fact, page 13 report, and actually develop the role of social work assistants. That allegedly started October last year. It seems as though it's been put on hold for the time being. Can you just give us a bit of an overview of that and what their roles would be and where you're taking that program?
Yeah, so one of the things we've been discussing about, there was a qualification for that social work assistants can undertake called a social worker practitioner qualification, I believe. And that would allow them then to undertake more in-depth, detailed work. So that is an area we're looking at. It's complicated in terms of the routes by which people would need to undertake that qualification, some of which can be delivered for free, some of which there's a cost to, and we're working through what the best approach is for us. By undertaking that practitioner course, it can form the first year of your social work degree. So it's potentially a pathway through to more qualified individuals as well. So it's an ongoing piece of work.
So us as a council, are we encouraging this? Are we working forward for this? And how will they then start to fit into the social work team?
So I'll just pick up a little bit more there, if that's all right, Lucy. So yeah, we're definitely as a council promoting this as a career pathway into social work, because you know there is a national shortage of social workers. So one of the things we've been very proactive in doing is encouraging our unqualified staff, social work assistants, and other staff within other areas. So, for example, in prevention and inclusion as well, and our preventative services, to undertake that first year of the degree course, just to upskill themselves, but then give them an opportunity. So we second, in the past, we've seconded four members of staff onto the social work degree course with a contract in place that they then remain with the local authority. This year we've that's to 8 spaces, because we know that there is that demand is there for social work. So we are we're certainly progressing that opportunity for our unqualified staff. Absolutely, absolutely.
It is the best way to do it.
Yeah.
Anybody got anything else on adult services?
Yes, I got two other things. One is the electronic assistance package, which is based at the library. How is that progressing? Is it improving in regards to take-up services?
So again, I'll start, and happy for Lucy to jump in here. So what we've seen, and actually the annual director's report is going to council in September, and there's some really good case studies in that report about the impact that has, the positive impact that has had on people in Newport, how it's allowed family members to feel more assured about loved ones remaining at home and keeping good communication through technology. So I think it was a very positive move. It go into the central library because it's more visible where it is, and there's more footfall through that. There's also, so that piece of work has been done. However, I know that the teams are talking about that's all well and good, but we now also need to upskill and our workforce to make sure that they are absolutely on top of all of these the technology that is available. So when they go and meet people for the first time in their homes, that they can start, you know, having those conversations from a very early stage, maybe before they need that sort of technology, to keep people as independent as possible for as long as possible. So I think it's been very positive. Lucy, if you want to add.
Yeah, just you'll see in Madam's report that she talks about the work that we're full on doing in this financial year, one of which is the review of reablement. And part of what we're looking at is how we can ensure that when somebody begins in reablement with us, we talk to them at the very start about what technology could support them. Very often at the moment it's left to the end of the work that we do with them. So what we want to do is make sure it's part of that whole reablement programme. Same in Parklands. So in Parklands we now demonstrate and work with people so they know how to use an Alexa, so they know how to use a comp. So there are bits of technology that they're getting used to whilst they're with us. So it's easy when they go home, it's more embedded in their day-to-day lives. I think one of the things that I see a lot when I talk to families is their concern about mum, dad, aunt, uncle going home, even though, you know, they're independent. They want assurance that their relative, their loved one, is going to be safe at home. And that's what a lot of the assistive technology can do. It can give reassurance to families. They can use a comp to speak to somebody so that they know that they are safe and well and everything's right. So it's helpful, that whole package, but moving it to the start of that process of reablement rather than being bolted on at the end is something we've embedded now.
So how is that put out to the residents? Are they going to go through social services to do that? Or are they going to be referred from the GP? Or do they rely on the package coming from a hospital or something like that?
Lucy, do you want to say all?
Yeah, so in general terms, we will do everything we can to publicise the hub, and you know, not just with the general public, but also with professionals. So you know, there is a communication plan, so reach out to GPs, district nurses, and other people that may come into contact with people in the community who might benefit from assistive technology. In terms of the reablement service, then that tends to be that is a referral from a social worker, a GP. It's for people that are at risk of going to hospital or coming out of hospital after a period of time. So they would have that referral from a professional.
What I'm trying to get at is, if we can put assistive technology at home, there might not be a need for a carer to go and visit. That's what I'm trying to get at. By the individual contacting somebody to assess them, then they could put down assistive technology, not the social services. Care going into the home once or twice.
Absolutely, and I think that's where Lucy is coming from, is for the social workers and the assessing social workers to think in that way from the first visit, as opposed to thinking of it down the line. But you know, absolutely, assistive technology, it is the future. It is you know, it will help with needs, but it will only go so far. You know, I think we need to be realistic about that, because you know, it's not going to be able to you know, help somebody out of bed. It's not going to, you know, get somebody dressed in the morning, and those. It can open the curtains, it can put the hoover around, it can, you know, could do lots of other things, but that physical care, you know, will always depend on humans. At the moment.
If I could just add to that, just in terms of how that information is out there, we work very closely in first inclusion with adult services, and we have all the carers we've worked through. So the unpaid carers, it's within my world, work really closely with the families world, and where we are working with unpaid carers, it's making sure that they're made aware of what the causes of variable like assistive technology. So we are, it's not just adults, nobody else, we are working really crossover to make sure that the information is getting out there as much as we can. It's not perfect, but we're doing it as we can.
One more, that is page 24, 15 of the report. Service area workforce demographic, 6 data. Doesn't give us an indication whether that's improved or not. All it says is 24, 25. I think it goes 23, 24. But that's something which I think possibly.
Certainly we can look at that, and I think that it's a very valid point, because and I think what we will make sure is that in the mid-year report that comes, that we can have that comparative data between 23, 24 and now 24, 25.
Okay, excellent.
Bev, can I ask you if there's anything you want to add? Nice to see you.
Thank you. Sorry I'm late. I just got on from work. Yeah, just a couple of points I want to make. I enjoyed reading about the Bridging the Gap project. That was really interesting, and I'm pleased to see that it is giving a lot of support to both adults and young unpaid carers. Couple of things. There's no, it's a good report, but within the report there are no demographic breakdowns, so we don't really know, you know, what ages we're looking at and the location and the type of caring role. So I would like to see a bit of that. And do you have any planned improvements or expansions coming for the coming year?
Certainly, but that, again, thank you for that observation. So just so we're absolutely clear. So when you talk about the demographics, would you like to see the numbers of the different age populations that adult services are supporting? So, for example, would you like to see the numbers of people that are being supported over the age of 85? Not 85, 65, which I know that we gather that, and under the age of 65, we can certainly look to include some of that demographic information. Is that what you were after, Councillor Davis?
Yeah, that'd be lovely if you could do that. It'd be nice for us to have an idea then of what ages we're looking at and what type of care that they're needing. I was pleased with the positive Yeston inspection for youth services. That was brilliant to read. Another thing that, excuse me, another thing that I tend to think about as well is with regards to feedback from service users. It'd be nice to see what feedback mechanisms that are in place to ensure that the service users influence ongoing service development.
Yeah, certainly, and I think we touched on this before. I think you were able to join the meeting, just to say that there are a number of service reviews that are happening within adult services as we speak, and as part of those service reviews, absolutely, we are getting the voices of people who are using the services to say, how is this for you? What is good about this? What needs improvement? And that information is being fed into what the end project will be, if you like, about what that service will look like going forward. So just to reassure you that we are actively seeking the voices of the people that we serve, and we will be using those voices to shape what the services look like going forward.
Oh, that'd be lovely, thank you. I'm a great advocate of feedback, so it would be nice to see how the service users are, how they perceive things themselves. Just another quick question. What are the long-term plans to reduce the reliance on external grants? It seems that we depend a lot on service grants.
So I think I can see Caroline looking at me to my left.
Yeah, Janet's shaking her head.
when we come on, which we will be next, to talk about the Prevention and Inclusion annual report, I've no doubt that Caroline will want to talk about this, because it is a what's the word I'm looking for? It's a risk. It's a risk for the local authority, because a lot of our youth service grants, our Families First, our Flying Start programs, all of that is community. It's all grant funded, and if that was to be withdrawn by Welsh Government, it would put a stop to the amount of preventative work that we were able to do as a council with the people of Newport to stop their needs from escalating. So we would see an increase in the number of children with complex needs. We'd see an increase in numbers of children coming into care. We'd see an increase in adults not remaining as independent for as long in their own homes. It would have a massive effect. We do lobby Welsh Government at every opportunity to highlight that risk. There is no, I'm not aware right now that there is any messages coming that those grants are going to be removed, but it is a risk for the local authority.
Councillor David, you know, a lot of the grant programmes, they are very big national programmes. So, you know, if they were to withdraw something, it would have a massive impact right across Wales. So I think that gives us some kind of safeguard to some degree that I think will be okay, certainly for now. And as Tanya says, we're not hearing anything about being withdrawn or cut. I think Welsh Government will be, you know, really having a right on their hands if they were to try and do something around that. They are very big national programmes that we're managing.
Yeah, I thought that. It's quite funny seeing Councillor Cleverly shaking her head, because I've written down points that I wanted to say, and I've written down questions, but I haven't put that divide between adult services and prevention and inclusion. So I apologise for asking you that question. But it is a concern, but hopefully, you know, what information you've given us helps to sort of relieve that concern a bit with regards to the funding. So thank you very much for that.
I was going to say, Chair, can I add something to this question?
I was about to bring you in, Jan, yes, please.
As I used to work for the youth service, Councillor Davis, we relied a lot on outside grants, and we used to have quite a big one from the European Social Fund. And this is how I first started my full-time youth work for the Night Rider project, based in Alway in Ringland and Somerton. And of course, we've lost that when we had Brexit, basically. But we do rely a lot on grants.
Yeah, it is a worry, and you know, quite a concern. Okay, thank you.
Chair, are we on to prevention and inclusion now?
No, I can see.
No, sorry. I won't.
That was my fault, sorry.
Okay. Steve, can I bring you in?
Yeah, thank you, Chair. I've got a couple of questions, hence why I'm like, definitely no, we've not moved to the next report. If I can kindly go back to the safeguarding aspects, I know we mention a lot about training, which is vitally important, but it's about the implementation of said training as well. So in the context, I'd be interested to hear about what type of, basically what type of referrals we get in to a degree, but also, you know, are they sufficient enough in terms of details? I know previously, you know, the value of the safeguarding referrals may not be the best. How are they looking these days? And again, that context, please. Thank you.
Thank you, Councillor Marshall, for that question. I think, you know, the quality of the referrals that come in to social services is always something that we monitor. And if there is not enough information from the referrer, then we will go back and clarify information. And at points, and Lucy may well be able to add to this, if we find that there is one particular partner agency where the quality may be poor, then we would have a direct conversation with that partner agency to see how we can support to improve that via training. Or better working together to understand the reasons why that is so. Lucy, I don't know if you have anything to add on that.
I don't particularly, but just to say, you know, regionally and nationally, safeguarding is monitored really closely. And, you know, the training programme that's being rolled out for practitioners at the moment comes from that, you know, nationally. So it is something that we work really closely with other authorities, and it's also, you know, with our colleagues in health, the police, and so on. So we do have close relationships with them.
Thank you. And just on the back of that question, I know we said about some organisations. Are you allowed to allude a little bit more about what type of organisations are having potential issues or anything, just so we can understand for context what is the particular issues at this current in time and who is being discussed at this time, you know, to be better?
Okay, so I'm not aware, it hasn't been brought to my attention that there is an issue at this moment in time with any of the organisations that are making referrals. However, if there were, then we will put those mechanisms in place.
That's great to have that reassurance, Tanya. It's just obviously with the linking in just to confirm what the context is currently. So that's really positive to hear, and thank you. I do have the other couple of questions there, and I know we talked a little bit about assessments and things, but what strategies are being trialled at the moment to address any delays within the initial full social care assessments, please?
Again, if it's okay, I'll start, and Lucy, I'm sure, will want to add to this. So delay in assessment is a pressure, is an issue for adult services, and that has been recognised for a long time within the Welsh Government space and the health board space. So those delays in assessment sometimes contribute to people not coming out of hospital in a timely way, or maybe escalating to hospital in an untimely way. What has happened in recent months is the local authority has received money, which is new revenue money, this has not happened for many years. This money is reoccurring, it's not a one-off grant, and the head of service, Mavamwi, and the service managers have been working really hard to put a plan together about how we can use that money to prevent the delays in assessment and strengthen the offer we have to keep people in their homes for longer and prevent needs from escalating, so people end up in hospital. This is all very new. This is literally in the last number of weeks that this has come into, that we were informed about this. we only met with Welsh Government because Welsh Government is keeping a very tight eye on how this money is being spent, and they want to be assured that it is making the difference that they expect. So we met with them last week. We've gone through the plans. They're happy with the plans, and they will monitor us on a monthly basis going forward as to how we are achieving what we're set out to. And some of this is about testing new ideas around, you know, sort of assessment and care planning. So, you know, testing new things to see if they work, see if the improvements occur. And, you know, that Welsh Government are very happy with that approach, because we don't know if something's going to work unless you have the ability to test it. I know that Myfanwy, if she was here, would be able to talk far more in detail about that than I am. But Lucy, I don't know if there's anything to add.
Yeah, we put a plan in place which has been approved by Welsh Government, and that was approved earlier this end of last week.
Yeah,
The very end of last week. What day is it? So, but what that has been, because we were already on the front foot in terms of some of the reviews that were undertaken, and because we've already identified pilots that we'd like to undertake for that work, we were able to use this money then to bring those pilots forward more quickly. So, for instance, I'm leading on the review for the reablement. So what that means is we are putting in place a team up front that will undertake those assessments more quickly, and also attaching additional resource to partners to bring people through and make sure they're placed back in the community more quickly. So that all helps the process of ensuring assessments are done more quickly, people would wait less time. You know, that is what we're going to be testing. So it's come at the right time for us, that we're well placed to take advantage of that money, the recurring money that Welsh Government are giving to us.
Thank you. I know a number of years ago, obviously in the safeguarding side, we launched a pressure, and then obviously extra monies were granted in order to try and alleviate some of that pressure. It sounds like that is actually occurring in this side of things there. But I suppose when you were speaking then, it's just a question that popped into mind, whether or not that we're using new technology and intelligence to be able to guide us to be better at understanding the needs of the population moving forward, but also how we're looking dynamically as well as said, like the safeguarding, about our staffing and work plans moving forward. Do we have anything in the background for these assessments to also have some support from intelligence and AI moving forward at all?
So what I can say is that we are at the beginning of that journey, and there is a sort of technology that is being developed which is called talk to text, and we're looking to we're not looking to do this in isolation. We're working with our Gwent partners SRS, who are developing this technology at the moment, and we are hoping that we can pilot this technology later this year, and that is going to involve training of staff. It basically will allow what is being spoken, the spoken word, to be translated into a written document to help to save time transcribing that. Now, you know, that is good, and we're actually going to be driving that forward. We must never forget, though, that we are delivering services to people, and that conversation and the way that we interact with people is a massive part of the services that we deliver. So as much as the technology will assist us, and it is assisting us in some of the back office stuff, we must never let it replace that human interaction, which is key when we're assessing both children and adults.
It is important because people are at the heart of this.
Absolutely.
You just can't cast them aside because we're too busy or whatever and tell them to talk to a machine. It has its place.
Agreed.
For sure.
Thank you. And further questions? That's fine for that. I got other questions as well. I've got why did key medium-term financial plan saving targets, so apprenticeships, domiciliary thresholds, fall short, and what are the consequences of that?
So why did the targets for the, sorry, could you repeat that? I didn't quite catch that.
Yeah, why did the key medium-term financial plan savings targets, such as like the apprenticeship and domiciliary thresholds, fall short, and what are the consequences of that?
Okay. So I don't have that knowledge to the forefront of my mind, so I'm afraid I'm going to have to take that away and come back to you with an answer. If that, I apologise, I can't answer that here. It's just one of those pieces of information it's not, I don't have.
That's fine. I understand obviously that you're not on the day-to-day as a sphere and hooking on for the head of service, so it's just to ask it to hopefully get a response to that, and I appreciate that. Thank you. The other one I've got then is what specific mechanisms will be used to measure unmet needs in respite care, and how would that influence commissioning?
Okay, so mechanisms to measure unmet need for respite care.
In respite care, yeah.
Okay, so I think we would, and again, I look to Lucy to add to this. There will be, there may well be a waiting list for respite care. So you would have heard at the beginning of the meeting about the work that was occurring in Centrica Lodge, which provides respite care for students. So that would be an indication, that waiting list would be an indication of this is an unmet need, and we would look to see if that need, how long that need would take to be met, and if it was too long, then we would have to look at commissioning that independently from a private provider as opposed to our in-house provision. Lucy, I don't know if you want to add to that.
Yeah, so we monitor Centrica Lodge and its ability to provide respite. We're supporting more families than we did previously. Stays at weekends are particularly popular, so we're really conscious of that, but we do have some capacity during the week. That's not necessarily when people want to book in with us. In terms of older people and respite, we have worked really closely with colleagues in social work team and commissioning. In Blaenorol, we now have a very successful respite service, which is used pretty much to capacity. I was there yesterday talking to a gentleman that was on his second stay for respite. He really enjoys it there, and he arrived the day that the previous person left us. So literally the bed doesn't go cold. But as a result of that, we are now opening an additional respite bed in Spring Gardens. Both these places are specifically for people with a diagnosis of dementia. So it means their carers can have a break. But it also means that we can guarantee, people can book in for their respite, they can guarantee that they can then go away on their holiday or to their wedding or whatever it is that they need to do, would like to do. So we're responding to that by monitoring demand and looking at how we can, in the in-house services in particular, open up our service for that respite provision.
That's great. Thank you very much. And the last one from me, Chair, for this report. What would you say to us as part of the committee as the main challenge we're facing in the local authority under this report area?
I think the main challenge is the increase in demand and the capacity needed to meet that demand. And again, as I've already said earlier in the meeting, there are service reviews that are underway, and they will bring much greater clarity to what needs to be done because we do have a growing population in Newport. We have an increasing ageing population, and that is not predicted to change. Therefore, the demand is likely to continue to increase. So demand definitely will be the main challenge.
Can I just add to that a little bit? Because I think that's absolutely right. One of the wonderful things is that people are living into older age, and they're living independently at home into older age. What that means is very often they come to us and they are more complex than perhaps they would have been 20 years ago. So all the work that we do with somebody can take more time, needs more support, more detail. But the wonderful thing is that we are keeping people where they want to be in their own homes. You know, and what we ask is your support to enable us to keep doing that.
That's great. Thank you, Chair.
Thank you, Steve. Okay. Trev, one last
With
question.
regards to what Councillor Marshall picked up was the answer was about dementia in regards to the respite. Is it majority of respite? Is it dementia, or is it something totally across the whole spectrum?
So there's pressures for both, if you like. As people are growing older and living at home, they might be with their partner, their husband of many, many years, and there is a need for that. That generally is for people who have dementia, because that is when people's caring responsibilities become very difficult to live with somebody you've loved for a very long time, whose character has changed, and to be there day in, day out. But we also have this group of adults with learning disabilities who are still living at home with mum and dad, or maybe their sister or guardian, and they need support too. For some of those people, they will be working to go into a supported living environment, but for others, their choice is to stay together as a family unit. But they, to stay together as they're choosing to, need that support. At the moment, Central Lodge is a provision that supports all those adults with disabilities, and we are keeping up with the demand for that. We also have contracts with Monmouthshire and Torvine, where we sell some of those places to them as an authority. So it's not just supporting people in Newport, it's supporting people more regionally as well. So I don't have the numbers to hand, but you know, I think we're looking at keeping abreast of both of those issues.
I didn't want the numbers, it's just the fact I wanted an idea of which was going, is the most concerns you.
Yeah. I think it's both. I think the need is both in both people with dementia and people with disabilities.
Thank you.
Okay, if there's nothing more on adult services, then we're happy to move on to prevention and inclusion review.
Do you want me to just wrap up what I've noted, Chair, to make sure we're still
Yeah, everybody's happy for that, so please wrap it up.
So I've noted that the committee content received a reply regarding the direct payment and status for the head of adult services, and from Councillor Marshall's question about MTFP savings. Right. I've noted the committee's recommendation about including in the mid-year reviews comparative workforce data, the supported ages data, and the feedback mechanism data. I've also captured a recommendation. I just sort of want to get committee's thoughts on it about supporting the service areas, about when they need to increase capacity where it's necessary to ensure sustainability. Those rising referrals. A committee happy with those? Anything to tweak? Anything to add?
Yes. Everybody okay with those? Yeah. Thank you, Beth.
Next one. So we do have Caroline as the head of service here. So Caroline, would you like to introduce the report?
Yeah, absolutely, no problem. I mean, the structure of the report is exactly the same as Tanya's laid out for adult services, so I'm not going to go through that again. But just a few headlines I would just like to kind of have the opportunity to highlight, really. Just to say that as a service area, the last year has been an extremely busy year again for all of the teams and percent inclusion, and that just indicates that demand for those services is not going away. If anything, it's growing year on year, which is a good thing because we want to be reaching people early and preventing their situation from becoming a crisis or escalating. So it's really good. The flip side of that is it puts additional pressures on us as teams and leaders. Successfully, we have been fortunate to deliver on a lot of the things that we highlighted in the mid-year report. Well, we touched on a few things that were our priorities, and we've been able to successfully deliver on those, such as opening the city centre youth service in the information station in town, and more successful internal audit this time for the adaptation team. There's lots of other examples to move forward, but just to say we have been able to deliver on some of those things, which I'm really pleased about. I just want to stress about the workforce, and I do make reference to it in the report in my executive summary about the workforce being our greatest asset, absolutely without a doubt. Without them, we wouldn't be able to do what we could do. As a service area, we place a lot of focus on their well-being, creating opportunities for development and succession roles. So as we're constantly reviewing our services, looking at how we can make improvements, what we're finding is we can sometimes, and probably more than I expected, it creates some additional roles that allows our staff to progress up into more senior roles, and that's been really, really lovely to see. And just really just to underline the complexity of the work that the team are dealing with. They may not be qualified social workers, but they are absolutely, in my view, just as experienced in working with families and children and holding very, very complex situations together. So I just wanted to kind of put that out there in terms of recognition of the work of the team that prevention and inclusion are doing. And just really just to highlight that we, just in a year's space, based on the data that we have collated, we can say we've helped and assisted over 33,000 individuals, which is quite significant. So again, it's an indication of that reach and that response that people are wanting to engage with our team. And I guess really the key message is, hopefully what you will have seen in the report is our intention to push as far as we can upstream, to get out there and be involved with people as early as possible, and for people to know about the support that's available so that they can receive that response earlier and more timely, without them getting worse and worse and worse, and then we end up at the front door of statutory children's services or adult services. So everything that we're doing really in terms of our direction of travel is really looking at how we can push further upstream and get people really early. So those are just the main things I just wanted to highlight. So I'm very happy to answer any questions.
Thank you, Caroline. Jan, if I could bring you in first.
Thank you, Chair. Yes, it seems a very positive report, Caroline. Just a few things I picked up on. I read that the youth and the play team have moved into new premises in Allway. Have they settled in okay? Is it all fine and wherever?
Yeah, I think fine, working really well, yeah.
Right, that was that. But the thing I picked up was on page 37 on the performance measures, because everything else before that have been completed, and but the young carers, are you having more young carers coming through? And because what I work, can I say I worked on a back to school project when I was last working, and I picked up quite a few in Newport High School of the reasons for being late for school or not attending is because they were young carers, and the schools never picked up on that. But it was only when I worked with them on a one-to-one basis, you know, that I picked up that, and probably your workers are the same. And the other thing about the youth service, I might as well say it all, the number of young people receiving information and support relating to homelessness. Have there been a large increase of young people being homeless? You know, so I'll leave you to answer that. Thank you.
So the first one, Councillor Cleverly, about the numbers of young carers.
Yes.
Has that number increased?
Mm-hmm.
I think we recognise, you know, you can see from the report, it is a red. We didn't hit target. And I know, speaking to Caroline, that there is some awareness raising that is going to be happening via the Bernardo's project with schools in particular, Caroline, isn't it?
Yes.
Yes.
That's excellent.
To do exactly what you said, to recognise and identify those young carers, because I don't believe we've only got that number of young carers across the city. And
no, and
it is a challenge identifying those children.
And Tanya, I know working with the ACES classes, I came across quite a few of young carers, you know, because the ACES classes, they cover all aspects.
Yeah, and you will do, and I'm not surprised to hear you saying that at all. What we are doing is a kind of a bit separate to that particular performance measure, because that's about how we collected the data in error previously, and we've rectified that now. But on top of that, what's happening is there's a lot of work being done between ourselves, Bernardo's and education. And obviously one of our cabinet members is Councillor Davis, who is also cabinet member for education. So we've got a really nice kind of triangle going on there. Young carers is often a source of our discussion. We are very, very clear, and I'm very clear, that as an organisation, we should have a much better handle on the numbers of young carers there are in Newport, and that we haven't got that at the moment, but that's something we're very much working towards. We've also worked with education to ensure that there was a young carers champion in every school setting. Every school has also received a young carers pack that promotes the services around young carers. There's lots of it, you know, we know there are lots of children out there and young people doing care and responsibilities. Not all of them want to engage with services, and that is okay. But it's still a piece of work that we need to be better at, and it's certainly a priority for us going forward, is identifying those young carers who exist in Newport. And on top of that, whilst government have set up a new ministerial advisory group specifically around young carers, and one of the priorities, and I sit on that group, and one of the priorities we've agreed on is the identification of young carers and how we can actually do that within organisations. So it's very, very a hot topic at the moment, and I would expect when I come back to you in mid-year, certainly by the end of the year, we will have some more information on that. But I think we've got a really good plan in place to move it to a better position.
Excellent. Thank you, Caroline, for that update.
Steve, can I bring you in next? You got a question on this?
Yeah, that's great. Thank you. Just one of the facts, what Councillor Cleverly was mentioning about the young carers and about recognising and understanding where they are. It just brings back to about a year ago, we've done the Young Carers Covenant. So it's just a question about how that's proceeding, because obviously that strongly links to this question in this area. Can the officers maybe give us an update about where that is and where we stand, and maybe what future plans are to maybe address some of these issues? Thank you.
About progress of implementation of the covenant, of the Young Carers Covenant.
Yeah. There is an action plan in place that has been drawn up following the young carers covenant in terms of what are the areas that are important to those young carers. There's a very clear action plan. I haven't got the actual update to hand, but I can certainly get that for you and provide that. But I do know that there's a young carers working group that meets monthly, and as I've said, that multi-agency with Bernardo who leads on the project, and they are working attentively through those core actions. But I can certainly get that information for you.
Any questions?
Yes, I've got, well, one is an observation, and that's on challenges, risks, issues faced by service area 24-25. Now, halfway down there, it says innovation to ensure we deliver the best we can with the funding we do have without having to reduce services. And following that says positivity, both government have diverted away from the 1-year budget allocation, 3-year commitment. So how is that going to benefit NCC? Hopefully it is.
It is a benefit because certainly in my world we are very, very well versed at going from year to year. So what yearly funding means, it's difficult for us to plan longer term. So we're often finding ourselves recruiting staff on a yearly basis, 12-month contract. That in itself causes issues because not people in this day and age can't afford to work on a temporary contract. They want permanent income, don't they? So, you know, there are all sorts of challenges around having annual budget allocation. 3 years means we've got longer time to prove the concept, whatever we're recruiting to, whatever we're trying to deliver, we've got longer time to deliver and provide the evidence and show what difference we are making with that funding. It's very difficult when you're doing short term. What we tried to do, I mean, it's very established in my work, is the way funding is, but what we do try to do is provide a rolling narrative. So, you know, whilst we provide annual reporting, because that's all the money we've got for this year, what we do is we always provide a bit of a rolling narrative in terms of the picture that we're dealing with, the challenges locally, this is what we're trying to do going forward. So that when next year's funding comes, we already have a plan in place, we know what we're going to do. But that longer term assurance of funding just allows us to plan better and plan more effectively, and particularly with recruitment and managing out.
So do we know the budget that we've got?
Yeah. Yes, so that's been confirmed for yes.
It's exactly the same or a bit more.
It'll be exactly the same. There won't be any uplifts, unfortunately.
The other thing is, Chair, commencement, go down to page 4, top of page 4. Thanks, Laura, staff expansion, 3 childcare. Can you explain a bit more? I don't understand 3 childcare.
So Flying Start is a programme that's been with us a long time. So there are 4 elements to Flying Start, 4 core elements. Childcare being one of them, enhanced health visiting, speech and language and parenting. So what Welsh Government has done, and Caroline is going to correct me if I'm wrong, is that they have given the local authority more money to roll out the childcare element. So we can offer free childcare sessions to more children in Newport. So that is the phase phase 3 rolling out. It's just the childcare offer.
You may recall in previous years I've talked about year 1, year 2. So each year the Welsh Government has given us another pot of money to roll out that phase. We are now on phase 3, and
so it's phase 3 of childcare, not just free childcare.
Yes,
I understand.
Yes.
Focused on childcare and uplifting that for parents.
The other one was in the same that this bullet point is improve support to parents and carers for centralising the provision. Expand on that.
So that relates to the parenting programmes that we deliver, or Caroline's service area delivers. And I think it's fair to say there was a wide range of different parenting programmes delivered in different parts of the service area. So a piece of work that's being done is looking at that as a whole and making sure we've got a common approach to the way that we deliver parenting across the city. Because I think it's fair to say it was a bit fragmented, and we want to make sure that it doesn't matter where you live in Newport, you'll get the same offer of parenting training, support, and that parenting support changes depending on the age of your child, obviously. You know, so parenting support for babies, for toddlers, for teenagers, but we want to make sure that there is a consistent approach across Newport. So that team is coming together in one space to make sure that happens.
Do we consult with NHS, especially with babies? I'm involved in a community centre where they have babies clinic type thing.
Yeah.
I wondered whether you are involved or consult with them or get advice from them in regards to the childcare base.
I do know our flying start team, the ones that work with our very young children, our toddlers and our babies, they have excellent relationships with health. So I know there's a lot of crossover and supporting each other on training. In terms of what we're talking about here, this is training that is core training and delivered by NCC. We're not changing what we're delivering. But the programmes that we do deliver are all evidence-based programmes. We've got outcome measures for all of them. We know they make a difference. But the reason why we're changing how we're delivering that is on the back of a review. So in last year's report, I talked a lot about what we're doing now with digging deeper into the quality of our services. And as part of that review, I did it on parenting, the parenting offer. It showed that there were some real inconsistencies of offer and inconsistencies of response. So depending on where you went, you might get a response, you might get different response. It wasn't equitable, it wasn't inclusive, and they're all the principles that we stand for in my world. So we decided on the back of that review is to put all of these different parenting programs that are all over the place, pull them into one space and do a new structure that we devised as part of our place-based strategy. And that will bring the consistency, the fairness, and greater monitoring as well. So I'm really pleased we've got to that stage now.
One further thing, Chair, and that's on the service area workforce again. Don't have a comparison with 2024 because I've noted that.
I can just ask, looking at on page 10 of your report, page 37 of the books, we talk about families first, and there's some reported metrics in there that in amber, and your comment says this measure is difficult to quantify. Is there a way of changing that? How you quantify, to gather the data, or B, do you actually need to be gathering that data? As the question being asked, are you trying to do something that is not necessary?
Yeah. There's a couple of factors in that response. One is the data systems that we've got are very embryonic. I suppose is the polite way of putting it. You know, we're a new service area, we're 3 years running now, but we haven't had an established data system to support it. So there's that element about how we're drilling down information and data and really providing more sophisticated reporting, and that's absolutely a priority going forward. But in particular to that particular measure, those are referrals that are going into the prevention team. And what happens there is a bit like what Tanya talked about earlier. When a worker does an assessment, with the family member or the family as a whole, they decide together what are the things that they want to work on. And we will never ever get just one thing, because families are complex by nature. They've got lots of issues that they want to sort on. So what we end up is we have a family plan, and within that plan will be their mental well-being. There might be family relationships. It might be helping to get their child to school, etc. So there will be a family plan.
Go on.
So it's kind of, it's difficult to break that down into individual items, for want of, in that plan. We recognise that, so we are going to be changing some of our performance as we go forward, because they should make sense, they need to be simpler. But I think some of this stuff is when we first came into being as a service area, was the case of let's throw what we know at it. But we're learning each year. We're getting more smart about what we are reporting on.
So sounds good. It's reactive. We've been an adaptive as well. And if I can just ask them on again page 34 of the main report, page 7 of your actual report, you talk about continue building on our participation and engagement strategy. It started in 22 and was completed in 25. And then with at the end of your assessment progress, you talk about the action plans in place linked to the service and team business plans. You've got champions in each team have been identified. We'll be meeting on a 6-weekly basis. Is that 6-week basis? Is that starting now as we go through 25 to 26? So when will we see some feedback on that, and sort of to be able to understand how well that's actually working for you as a department?
Absolutely. I've got service managers who are monitoring that really tightly and are leading on that piece of work. So that is something that I've been assured is in place and will be happening. They will have an action plan that they'll be working to, so it's not just let's get together, they talk about something. They have an action plan that they've agreed on, and they will be meeting to talk and progress that action plan. So I will be able to bring that progress back to you as we go through the next year.
Any other questions? Steve?
Thank you, Chair. I've got a couple there. Thanks very much there. I suppose the first one is more of a comment rather than a question. Obviously, the prevention inclusion area covers quite an important area of council policy now, which is the anti-poverty area. It's only been noted as one point in Objective 3. I suppose in expectation, I would have expected a lot of the other areas to kind of link in a bit more to the anti-poverty areas, because they all do link into it and about what we're doing in services. So I'm just wondering, in future reports, could we maybe look at that a little bit more about how each of the areas do link into the anti-poverty strategy, and about how it does meet, and tries to raise people up from such poverty. Even though we know the work has been done, it's just about how we portray that to the general public. So that's my comment, if that's permissible, Chair. The other question I've got is, within the 33,000 interactions that's been noted about, and that obviously really, really positive, I think it's just about how is that being showcased other than just volumes? Is there more possible ways to link in about, this is a person rather than a number, this is how we've helped these people left, right and centre, but it may bring back to what I've just noted about the anti-poverty side, so it might link the two parts. So I'll give way for this one if you want to come in either. Thank you.
Yeah, the 33,000 is just kind of putting that out there to show the reach and the volume of people that the service area is working with. Absolutely, within all of those teams and what they offer and their interaction with individuals and groups, we will be able to break down in terms of what they're getting, what they need, what they're asking for, and the outcomes. Because for us, it's always about, well, what difference are we making? Because if we're not making any difference, we're doing something badly wrong. So there is absolutely a possibility, you know, we can get that information if that's something that you want to see going forward, and then kind of breaking some of that information and data down to cross over to the poverty link and kind of, you know, how many of those are we thinking about who are impacted indirectly or directly by poverty. You know, that perhaps is a piece of work that we could do, and perhaps I can talk to Tanya about how we might do that.
That's great, Caroline, for the answer, and Chair. Thank you. Obviously, it's such a big area, and I know it's a great interest to the council, more so since the cost of living, and also how we're progressing now with extra strategy boards and things like that as we're moving forward. So I do appreciate that, and thank you. I know it's still in that development phase of linking in, so I do appreciate that. Thank you. I suppose the other one, obviously, an area of interest is about young people and about how will youth outreach models respond to young people not currently engage with the services or maybe face digital inclusion, so they might not be able to access any support, whether or not it be online or in person, and about are we getting it right for the young people. And the other scope, I suppose, is yes, we've got the youth service and they do a lot of great work in the informal side of things there, but how do we reach those young people that may be, you know, causing antisocial behaviour through the youth justice system, things like that? How do we ensure that there's space and capacity for them, and how are we exploring ways to bring them in? Thank you.
Well, you know, the whole principle behind the tattoo work team is so that they are not based, they're not asset based, which is where obviously these clubs and activities are often delivered for. So the idea is for the new team on Fully Recruit will be out literally roaming the streets and responding to the hotspots, as we call them. So the team is very tightly linked into community safety and part of the subgroup around antisocial behaviour in particular. So one of their focuses will be linking up with the resources that are available from wider council teams in terms of community safety, and just I think it's about being more smart about using intelligence we have corporately, not just the youth service, around what do we need to do and how can we respond to those hotspots of antisocial behaviour. So the idea is that the team will be able to kind of float, know where there are issues, there are problems happening in the neighbourhood, and then can actually target and close time to engage with those children on the street, in the park, wherever they may well be, and as an opportunity to engage and have a conversation and find out what's going on for them. Because we do recognise not all young children want to go to a club. You know, it might be seen as being too uncool, or you know, it's just not how they want to be. But we do know an outreach model works. We've learned from that, and we know that our colleagues in Newport who have had real success in having an outreach team. We know it works. So it's a model that we haven't got at the moment, but it's something that we're really keen to develop and to kind of reach more children, because we know there are lots and lots of children out there who probably would benefit from having a trusted adult conversation, somebody who's safe, somebody who's not going to judge them. Doesn't mean anything's going to happen and nothing be taken away, but it's just a starting of an engagement, so that if they are mixing up, particularly with a crowd that's getting them into trouble and becoming attention to the police, let's talk about that. Let's see what we can do about that together. So that is the plan. We are still in the process of recruiting for that team. We are having some challenges with the recruitment in terms of quality recruitment. So we're not fully there yet, but we're certainly expecting to be moving on that in the next couple of months.
That's great. Thanks very much for that response, Caroline. And I think the other one, just as I finish with the other report there, is just other than the budget, obviously the budget is the main concern because of the reliance heavily on external grants coming in, and just basically looking to make sure that, you know, we are able to sustain the amount of services that we provide where possible. Other than that, what do you believe is the main challenges, and is there anything that you want to make us aware, so that we're able to either have knowledge or to be able to push for change?
You know, I think we're not alone in this big world of grants. You know, it's quite unique here in Newport what we've got. Well, we've got this service area which has got all the right services working together, because they are now working together, they previously weren't. So it's absolutely right to bring them together. But what we've now got is a service area that is pretty much 95% reliant. And we can, you know, that's highlighted now even more because of this service area where previously it was scattered all around the council. So there are pros and cons around that. You know, for me, I think we've already touched on it earlier. I'm not having too many sleepless nights because I don't believe whilst government are anywhere near at the point of withdrawing any of these big funding programmes that we've got. That said, any lobbying and any support that members can provide for us with the Welsh Government around the importance of sustaining some services, particularly the lower end preventative services, which are largely grant funded, yet are absolutely embedded in key pieces of legislation. So we are required to do it, but how we do it is up to us. So we really do need to think about how we can. I think the challenge for me is how we get Welsh Government to think about it in a different way. And it's a conversation I have often with my cabinet members who I talk to on a monthly basis, you know, what they can do to assist us. But at the moment, I feel assured that we're okay, certainly for the next 2-3 years at least. And I have got absolutely no indication that anything's going to change. But my famous last word, that, you know, it could all change tomorrow, of course, but I'm certainly not hearing anything. But yeah, my ask would be to any support for lobbying of Welsh Government to kind of, influence the thinking around short-term funding, make it longer-term funding, make it more sustainable. If we ever get to the point where some of that funding could become part of our core allocation to local authority, that would be a really happy day for me. But we're a long way from there, and I recognise that.
Thank you very much there. My computer's going to reset, but I'm just going to trigger onto another computer. But is there anything else other than funding that's a challenge that you want to make the committee aware of? Thank you.
I think probably what Tanya said earlier is demand. It's absolutely demand. There is no let up on referrals and contact coming through our doors. Some very, very, very difficult, complex situations we're seeing in families and children. Some on the back of COVID, you know, in terms of the impact it had on them. Some of it is around family stuff. But there is no doubt there's a lot of families who are not engaged at that higher tier of social services yet, but are coming to our doors, and that's where particularly the prevention team and the youth service are working with an awful lot of those complexities. So the demand and the complexity are not lessening, they're not easing up. And for me, the challenge there is how do we keep responding to that demand in a way that we want to, with probably what is essentially going to be a reducing workforce over time, because unless grants are uplifted, we are technically reducing our capacity to deliver, because we've got to pay staff more, we've got national insurance and all the rest of it to pay. That means we do not have as much money for the frontline delivery. So, you know, that is the challenge for me, you know, and that is something that does worry me, is how do we keep responding to people who are absolutely being referred to and coming to our front door, coming to our doors, and how can we keep responding in a timely way? Because the last thing I want to see is prevention services and early health services being backed up with waiting lists. They don't go hand in hand. They really do not go hand in hand. And that is something that I'm constantly working with the teams on, how we are managing these waiting lists, because this is not okay. We can't just sit on these waiting lists. So that's something that we work with all the time. So that's probably the biggest other challenge.
That's great. Oh, sorry. Thank you, Chair. Just to let you know, I am back. My computer switched itself off, as you probably guessed. It's uploading the Windows 11. So thank you very much, and I am here.
Okay, thank you. Thanks. Bev, can I bring you in? I know you've been waiting patiently there.
Thank you. Just 2 short questions. I want to know how the community hubs, like Galway and the Gare, are being assessed with regards to effectiveness and community impact.
Gosh, it's probably a bit premature for me to be able to give you a really sophisticated response to that question. And I say that only because literally only in the last 2 weeks we've been able to recruit to a manager's post that we absolutely need to take that work forward. So we've got the vision, we know what we want to do in terms of place-based care and supporting communities in communities and having the house available for them in their communities. I talked earlier on about our data position. You know, we're doing a lot of work on trying to improve our data system, and so that all of the stuff that you're talking about in terms of how we're measuring the effectiveness and how we're measuring the difference that we're making for these people, we will be able to easily drill down. At the moment, things are kind of on a spreadsheet, a bit of paper. We're moving into a much smarter kind of data analysis this year. That's certainly one of the priorities for me, and we'll put things in place to recruit to a particular post, and we're getting external support to help us think about our ability to do smart reporting and provide the evidence of what we're doing. Without all of that, what I can absolutely say, just from listening to people and seeing the case studies that come through, I absolutely do know having those services and teams in the community is making a difference. I know, for example, on whatever day Citizens' Rights Bureau is in Galway, I know that there was a queue outside around the block before the building goes down. So we know people are responding to these services in their communities. So that's telling us it's working. What we need to do is kind of do the data capture to evidence that for reporting purposes. But that will come, and I can assure you that will come.
Okay, thank you. Just a quick observation now. I mean, it's case study 5 on page 42, and it's very heartwarming to read what that service user has said with regards to the what's the word I'm looking for?
On that one, yeah.
The level of interaction and help that they received, and so hard to see then that they're no longer that they're no longer having an impact with them because they're not service users anymore. But I do find it quite encouraging when I read things like that about how everything is sort of pulled together for the service users to give them that really fully joined up help that they need.
Yeah, thank you for that feedback, and I'm heartened that you read these case studies and feel that, because what we try to do is bring alive for members the work that we do and the impact it's having, and particularly with that case study, it really evidenced the magic of early help, and you know if we can help people in small ways and earlier, it's actually so much more cost effective. And that again is part of that reporting and thinking about how we get that evidence so that we can demonstrate to people like yourself. It makes a difference, it's cost effective, and it's worth it. That's the space that I want to get to. But you're absolutely right. I mean, that just captures it all beautifully for me. That is the magic of early help.
Yeah, thanks for that. I find it very encouraging when I read the case studies. It's nice to see how it is affecting the service users. So thank you very much for that.
Thank you very much.
If I could just pick up on the community consultations engagement on page 43, and it's just a bit of clarity, really. I mean, it's always great to get feedback, and it's always difficult to know what sort of feedback you're going to get. But I just wonder if you can give us a bit of context around. We've got 712 responses for online staff survey on place efficiency, but then only 9 responses on the next one, which is family play session. Is understanding what sort of pond you're fishing in to start with, as to what responses you get, because you might not think 9 is an awful response, but maybe you only ask 10 people. Then 9 is a fantastic response. So it's just a bit of some more clarity for us as a committee to understand whether it's a good response or whether actually was it worth even doing.
That's a really good point. What I can absolutely say is all of those consultations relate to very different programs. Okay, so when we're doing a review or when we're going to go out and do a new project, what we want to do is get that feedback from members who may be in that cohort of service users using that service. So it will vary, the figures will vary, and they will always vary because they are very, very different programs. So for example, the place efficiency, and I'm thrilled that we've had that amount of response because previously when we've done this every 3 years and we have to do it by law. The response was incredibly low. There was something like I don't know, 60% increase on our response level. And that's because we've adopted a very different way of doing it this year and it worked and we're learning from that going forward as well. So that is about the place efficiency is a corporate assessment of how well Newport is able to provide sufficient play opportunities for children. So it's not just the prevention and inclusion issue, it's the whole council issue. It's everything from how safe to the park, how well lit is the alley to the park for the child to get to it. So that is a particular assessment that we've taken, and that was a massive response we've not had before, but that's brilliant. Other things like the complex play scheme questionnaire, 20 responses. Complex play is our play provision for children with disabilities and additional learning needs. And about 2 years ago, we started to remodel that provision because it wasn't, I felt, and some of the team felt, it wasn't set up appropriately, inclusively, and it needed to be improved. So we did some remodeling work. As part of that remodeling work, we were, and kind of testing out the impact of that, we will send out those questionnaires. Now, you're talking about a much smaller cohort there, children with particular disabilities and their parents who may have taken the time to respond. Whilst the first one, we were able to flip schools and go into the schools and go to lots of different forums where we could get responses. So they're just very different kind of programs, different focuses and different cohorts. There may well be the same people answering 2 or 3 of those things. That's just the nature of the communities we work with. Okay.
Well, yeah, thank you for that. It's quite good. It just allows us to understand that 20 is actually a great number.
Yeah.
No, thanks for that.
Any other questions?
Yeah.
Yeah.
Finance, workforce, demographics. Areas of discussion. Explanation on that is, I assume that's an underspend of 570k.
Yeah. Now, yeah. So that the finance information you've got there relates to a very small pot of money I have from corporate, from council. Okay, so it's a tiny amount of money that we receive, and then 95% of it is grant. Okay, but that's not reflected here, and I've discussed that with people who are having to do this report, but that's a conversation that's ongoing. So the information you're looking at is my very small corporate budget, and the staffing budget underspend there relates purely because although we are only funded very, very small by Newport Council, we are colleagues and partners, and we are all what we call CAT team. So we are just as committed to supporting Newport with their budget. We do it as one capital. What we found is that, and we've got better at this each year, is managing all of our grants really, really robustly and effectively. And what we're doing, we will always look to maximise grants before we start drawing on NCC budget. So what we do is, although we've got an allocation, a core budget at the start of the year, by the end of the year and throughout the year, we can identify underspending in grants. What we'll do, we'll draw staffing costs against the core budget, against grant, so we'll move it against the grant. That means it shows, oh no, we're not spending any money on nothing. We are absolutely, but we're picking out these grants to support financial profit. That's clear.
Yeah. That explains it.
Okay, it's always about maximising grants with us, because what we never want to do is
Don't
send
say
it back.
anything back. Don't say anything back.
Thank you.
Okay.
Any other questions? Are we happy to move on? Sam, would you like to give a
Yeah.
sum up for us?
So I've noticed that the committee of content received the action plan for the Ymddiheuriadau work group. I've got our recommendations about including the comparative workforce data, the further information about how the work of prevention and inclusion links with the anti-poverty strategy work, and the showcasing of the interactions to complement that work, the volume of the interactions. I've also kind of captured what Councillor Marshall was saying about a wider recommendation from the committee about recommending that Cabinet continue to lobby and support for longer term, more stable funding regarding preventative services. But is there anything the committee want to tweak or add or big way? Or we content with that?
With the participation engagement strategy. I think you mentioned you're going to put it into the midterm report, is it? Or you know, that is a separate.
Progress, it would be part of the midterm, so the progress on the participation engagement strategy.
Yes, yeah.
Yeah, but I know the chair.
That's great.
Thank you very much. Thank you. Thank you very much, everybody.
Lovely.
Yes, you do. Sun is shining.
Yeah.
Bonus.
Those neatly.
Thanks for that. No. Thank you.
Okay, if I can just drop back to point number 3, minutes of the previous meeting. Any comments? Any, were they reflective? Everybody happy with them?
Yes, I'm happy,
Yeah.
Chair. Thank you.
We haven't had an update on the residential accommodation yet.
No, we haven't had anything to about that one, but I put it as a note on our full work programme because it's
Yeah.
due to the information. But yeah, all noted.
Take us through the 1.5 actions arising.
Next ruling. So no updates on our actions at the minute. As they're still the ongoing ones. No changes to our forward work programme, but is there anything the committee want to look at adding either off the back of today's discussions? Obviously, we've got a couple of things noted for further information, but are you content with the forward work programme as it is at the minute?
Education is, I'm concerned about educating professionals.
Okay.
Something. Want to delve into that a lot deeper. As to many do we have, how we monitoring it, the main reasons for it. We want to have people just educated for because their tendency from it.
Okay, so would you want to start at a point of sort of an information report about that kind of data and then look if necessary to bring it into full scrutiny, or I would
Yes.
Yeah, start with that. I'll speak to Sarah Morgan about that one then. No problem. And on our outcomes, you'll be able to see that they're all updated.
Yeah.
Obviously, we'll have a few more to add to both the actions and the outcomes tables for next time, but nothing new to add from each year other than to say our next meeting is 2nd of September, and that's for the Director of Social Services annual report. Okay.
Okay. Anything from anybody else? Feel okay?
And just to say, I've caught your comment, Councillor Marshall, about including information about AI use within prevention and inclusion.
That's brilliant, thank you. Sorry, I'm going between devices at the moment. The other one I was wondering, I don't know if it directly affects us or another committee, but for informational purposes, can we add in about the community parenting strategy as well? Because I think that does link into what we would need to know as part of this committee.
So that's really relevant, actually, Councillor, that you've mentioned that, because that's something I was going to do after this meeting. Obviously, we've got an action on that about sharing that when it's published. That has been published. It's going to overview on Thursday this week. Obviously, it's still a draft strategy at the minute before as it's going to overview, but I'll share those papers as soon as the meeting ends.
That's great, Sam. Thank you. It's just for all colleagues just to be aware of that as well, because it does affect us as a committee as well. So thank you.
Okay. Thank you, Steve. Okay. There's nothing else?
Nothing else from me, Chair.
Okay, well, thank you, everybody. Have a lovely evening and see you all on the 2nd of September.
Okay, thank you. Bye.
Thank you, Chair.